Good afternoon. I want to thank everyone for being here again today. As you know, many schools started this week, and I again want to thank our school administrators, our teachers, our parents, school nurses, maintenance crews, and all school staff members for looking out for Missouri students. Our kids are truly the future of our state. We know it hasn't been easy preparing for this school year, but we are very grateful for your positive outlook and hard work to ensure we keep our students safe, healthy, and moving forward. We are excited to share some big news today regarding COVID-19 testing. A new saliva-based COVID-19 test developed in Missouri has been approved for use by the FDA. This test, developed by researchers at Washington University, is a major development in testing technology and will help us continue to increase testing volumes and improve turnaround time for test results. We have been focused on significantly increasing access to testing throughout COVID-19, increasing testing volumes from 15,000 per week in early April to more than 90,000 per week today. Today's development will help continue that progress. We have been engaged in conversations with WashU for several weeks, and we expect to have further updates in the coming days on how this technology can and will be used to increase COVID testing in Missouri. We continue to see increases of COVID-19, especially among 20-year-olds, as many return to college. However, the vast majority of these cases are not being hospitalized. Overall, our healthcare system will remain well below capacity, and our fatality rate has declined significantly. During April and May, more than 7% of all observed cases in Missouri each month were sadly fatal. In June, that number quickly dropped to less than 2%. It is now less than 0.5% for August. This is a good sign, and we must continue to stay focused on the health and safety of our friends, our families, and our neighbors. We are approaching the 6-month mark since COVID-19 hit Missouri. My administration had been monitoring this virus since January. And when the first positive case was identified on March the 7th, we were fully engaged and immediately on the ground in St. Louis. Since that time, we have worked nonstop to combat this virus and keep Missourians as safe as possible. We pulled together our entire cabinet, every state agency, to coordinate our response. We convened weekly calls for 4 straight months with community leaders and medical experts. We were one of the leading states in the country to develop a dashboard with Missouri data. We mobilized the Missouri National Guard to assist with our response efforts. We constructed an alternative care site in 11 days to assist hospitals in the St. Louis region. We delivered remdesivir to hospitals across the state in the middle of the night to help COVID-19 patients and save lives. We waived nearly 600 statutes and regulations to provide more flexibility and safety for Missourians. We partnered with Google to launch the PPE marketplace and have continued to expand our own state supply. We went from testing only 2,000 people each week to testing nearly 100,000 a week. We announced our Show Me Strong recovery plan on April the 16th and officially launched that plan on May the 4th. These are just a few examples of the tremendous amount of work that has been done over the last 6 months. It is truly remarkable to think about how far we have come. Missourians have all worked extremely hard to help get where we are now, and we must keep up our efforts. And as far as the economic recovery, we received more good news. Last week on Missouri's unemployment rate. Missouri's unemployment rate dropped again from 7.8 in June to 6.9% in July, with employment increasing by over 52,000 jobs. This is more than 3 full percentage points lower than the national rate of 10.2 and puts Missouri in the top 10 states in the United States with the lowest unemployment rate. Already, we have recovered nearly half of the jobs lost to COVID-19. Missouri's economy is recovering. We are on the right track, and we will continue to do everything we can to build our economy and help Missouri families, our businesses, and communities recover from this crisis. We are also happy to announce that the Missouri Department of Labor will begin releasing lost wages assistance payments this week. Missouri was one of the very first states to apply and receive over $200 million in the latest round of federal funding. Families across the state are in great need during this time, and we're doing all we can to deliver the extra federal assistance provided by President Trump's executive order to Missourians as soon as possible. This week, we are traveling to several health care facilities across the state to meet with the leadership and discuss the expansion of telehealth services during COVID-19. Yesterday, we visited the Jordan Valley Community Health Center in Springfield and the FCC Behavioral Health Center in Poplar Bluff. During those two visits, we realized how much telehealth, telemedicine is so important to our state, especially in rural Missouri. And when you see the call increases that most of these facilities have went something like 4,500 to 50,000 calls for medical services during this time of COVID-19. I want to thank all these organizations for stepping up, providing the services for mental health, providing a service for everyday health care for people that couldn't come in during the virus situation. Again, these are what really proves to us in the state of Missouri why we have to do more on broadband, why we have to provide that service to all Missourians no matter where you live. You should have the ability to have broadband. If we can put electricity in every home, we can put broadband in every home, and where kids can learn, where people can receive health care, and people can stay safe by that. Again, it's one of the priorities I've had since governor from day one, and will continue to support that. We also had a chance to tour the Southeast Missouri Food Bank in Sikeston yesterday. And it was one of the most impressive food banks I went in Southeast Missouri, considering they're covering 20-some-odd counties, and I think are supplying almost 60,000 people with assistance in the food bank industry. 17,000 of those are children. Again, doing this during the time of a virus, trying to make sure everybody are being fed and being taken care of. So I want to thank them for the services they're providing in Southeast Missouri. This morning we traveled to MU to the Women's and Children's Hospital in Columbia, and this afternoon we will travel to St. Louis. On Thursday, we will visit Rediscover in Kansas City and Access Family Care in Joplin. Today I want to end again, as I have for almost 6 months, saying the same thing I've said over and over at every one of these press briefings. The three most important things we can do in the state of Missouri to protect ourselves, our families, our friends, and our neighbors. Social distance, wear a mask, wash your hands. We have said this from day one. It was important then, and it is important now. This virus is still here, and we must continue with our efforts as we move forward. Thank you, and God bless. Dr. Williams is also here today to take a few questions, so Kelly, I'll turn it over to you.
All right, Dr. Williams.
Thank you, Governor. I just want to start out with a few announcements. One, I would argue that it is in the character of Missourians, in the DNA, to help other people at times of need. So we're incredibly appreciative to our Task Force 1 that left yesterday to go down to Texas for Hurricane Laura, Category 4 storm. And I have a good friend, Ellen, who trains dogs for the water rescue team and the land rescue team, and I know how hard they work. And so we greatly appreciate that, and our prayers are with them as they travel down there and with the people of Texas and Louisiana as that storm approaches. On a different note, I know people tell me that they are interested in the mask I wear, so today we're going, and this shouldn't be a surprise to you, for all you 20 and 30-year-olds, this is a good day if you think the boys in blue are back. Yesterday had a little game here in Missouri between the Redbirds and the Royals, and congratulations to the Royals for prevailing 5-4. But just one more good reason, if you're a young person and you can't social distance, to wear a mask to celebrate the Royals and to get the Redbirds back in it. As the governor said, one word I really want to key on that he said is coordinate. I told the House on March 2nd that I thought that come what may, and our first patient, as the governor just said, was on March 7th, that through communicating, coordinating, and collaborating, that come what may, we would meet the challenges that this novel virus presented. And that has, in fact, been the case. I start the week on Monday, heading an echo at the University of Missouri. On Wednesday morning, I'm with the intensivist from Kansas City and Lee Norman, my good friend in Kansas. Then Saturday every morning for the last 5 months at 10 o'clock, I'm with the governor with the ID doctors. So Kit Bond told me one time the key is to listen. And so we listen very carefully as we coordinate the state's effort. A diverse state, but we coordinate it. And where that's gotten us right now is, as we speak today, we are 17th to the best in the United States for cases per 100,000. We are better than 33 states starting back in January. And that's a testament to the Missourians and the leadership of those Missourians and throughout the state who've done what we've asked them to do. And our positivity rate, though, and we're very conscious of this, Ambassador Burks talks about that, while our hospitalizations, our mortality, our long-term care facilities through 130,000 tests, that we've reduced all that to less than 1%, our positivity rate and our case rate is up. It's been down for the last 3 days, under 1,000, but that could change. I tell you, we always look at 7-day averages, so we'll see what today brings. But I need your help. I'm going to continue to ask for your help to get the message out to our 20 and 30-year-olds that this is not a benign disease. I'm well aware right now of a 24-year-old who's got pneumonia and had to be worked up for a blood clot because one of the unique natures of this virus is that it causes thrombogenesis. It causes blood clots. So it is not a benign disease. It may be low risk for some people, but even young people can have adverse outcomes, much less the people that they could infect who are in more high-risk populations. So I'm going to continue to ask you, and we're going to continue to be very, very purposeful about, just as we looked at long-term care facilities and reduced our mortality and morbidity, we're going to look very closely at our 20 and 30-year-olds and trying to reduce that as we open up the universities and others. So with that, Kelly, I'm glad to answer any questions.
Okay. Any questions for Dr. Williams, Kelly?
You mentioned how closely you're monitoring the situation. I mean, obviously Missouri has a lot of big schools, Mizzou, UMKC, Northwest, Mo State, things like that. How close are you monitoring that situation as those schools are reopening?
I was work with Zora very closely, and when we talk about schools, we're talking about, I work very, very closely with Margie on our K through 12. We talk almost daily, and working with Zora, I was with her on a conference call with all the university presidents on, I guess it was Monday, might have been Tuesday. And so we are watching that very, very closely. As you know, that is a national problem, that if you look around the country, I'm pretty familiar with this, that universities are being set back by rapid onset of new cases. I can't thank my friends, Lee Norman in Kansas. I spent all last week working with them, looking at their situation and our situation. We have 500,000 staff and students, I believe Zora told me, in our university system here in the Missouri system. So we are watching it very carefully. Now, take Boone County. They had two of the highest case rates they've had last week ever, and half of those were between the ages of 18 and 22, I think it was. So that's what we're seeing, and that's what we're very dedicated at this part of this novel emerging virus. We know that in that age group, it is infectious, that it spreads quickly.
Hi, Dr. Williams.
Hey, Philip.
It was reported nationally this morning that the CDC is changing its testing guidelines,
Yeah.
Specifically to not test people who are not symptomatic.
Yeah.
What's your understanding of that, and will that change Missouri's testing strategies?
Yeah, Philip, thank you so much for the question. I've been on the phone all morning trying to learn more about that with my colleagues at ASTO. We have a conference call on Friday with the Council of State and Territorial Epidemiologists, all the state health directors, and I've got a call in to HHS. It's unclear to me why they've made that recommendation. I intuitively, that's not the path that I would set out on. That we're promoting, the governor has worked so hard that we can do 100,000 tests a week, that at this point in time, unless I'm presented clear evidence differently, we think that Missourians who want to be tested, who need to be tested, that we would really encourage them to get tested and use the discernment and the judgment of their clinician. But at this point in time, barring something I learned that I don't know yet, that will not be the direction that I'd recommend Missouri go.
Sebastian?
Hey, Dr. Williams. With the hundreds of thousands of students, not hundreds of thousands, just hundreds of students who've tested positive at campuses across the state, does the state's boxed-in strategy apply to college campuses? Yeah. And also, what specific metrics are you looking at to assess those conditions getting out of hand?
That's another great question. Ambassador Birx addressed that, and she said to us specifically, y'all have done so well on your boxed-in strategy, but I've got news for you. For college campuses in this age group, you're going to have to pivot, because they're mostly contracting this in social situations. You know, boxed in is really for congregated facilities. And so one thing, Jack asked me last week, what did I take away from the meeting with her, and I've reflected on that. I thought it was a good question. But that's one thing that she said. You're going to have to adapt and do differently as opposed to boxed in, because they're super spreaders and they're getting it in social situations that don't lend them. You can't go into a bar 2 days later and box it in. It's already moved on. And so I very much appreciated her insight into that.
All right, Emily, final question for Dr. Williams.
Dr. Williams, is there any backlog in the state at all, or is the state completely caught up? Where does the state stand in testing?
As of this morning at 9 o'clock, we were a little bit behind. We've been completely caught up, but for this morning, and I can't remember the exact reasons, we're just slightly behind, but we'll catch up by Friday.
Is there a number?
I'll get it to you. I just didn't hit, but it's low. I mean, remember, I know you've been very diligent about checking up on that. At one point, I think we were at 10,000, and this number is a lot lower than that, but I'll be happy to get that to you. Thank you, Kelly.
Thank you. Governor Parson?
You've got some unfinished business on the special session. The House left or adjourned without taking action on money, concurrent jurisdiction, and juvenile penalties. What are you urging them to do?
Well, I think 5 out of 6 is a good day when you're dealing with the legislators on that. So we're very pleased that we got 5 of the things that we had of the 6 on that. We would have loved to have seen the juvenile situation be able to get that done. That was very important to us. But we will check on that when the day comes to be able to do that. We okay over there? You all right? Let's just take. Are you okay? Yeah, just sit down for a minute. Sit down. You're good. Yeah. These press briefings are tough. I'm just telling you, they ask some questions. You take care. All right. You ready to go? Yeah. All right. Kurt, I think I was on your question there where you just asked me about special session on the things, and basically, we're very pleased where we got 5 out of the 6 done. Jurisdiction is something I think was very important. That come later on in the session. I still think anything we can do to address violent crime in this state. And I do want to say, with what we're doing with session, given the tools that law enforcement needs, that prosecutors need to be able to take violent criminals off the street is a win for Missouri right now. And I think a perfect example of that is when you see what Legends is doing that come to Kansas City. Some of the numbers you're seeing there in St. Louis have been so positive. But I think the most important thing out of the Legends is what really happens when the federal government, the state government, and the local counties and the local cities work together to really fight violent crime. And it is making a difference. So just more tools for them to be able to use to take crime down in the state of Missouri.
Representative Cody Smith had said on the floor this week during debate that you'll be calling the legislature back in to fund the witness protection program. Is that what your plan is to call special session on that? And then also COVID liabilities for schools, businesses, and that sort of thing?
We'll deal special sessions as we move forward. But one, I mean, the legislature's going to have a plan. If we're going to come back for legislation, we got to have a plan in place to have a special legislation to get it done. So I think liability is still a big issue out there. But right now, we're going to have to see if there's a path forward on that. As far as the funding goes, we're going to look and see whatever funding we can get to, that we have the capability to get that out, simply to make sure that that witness protection program is working as soon as possible. But again, the legislature will have a part to play in that because we're going to be needing the budget money next year if we don't have it this year.
Hi, Governor. I'm assuming the saliva test is more of a rapid-based test, and if so, how long until there's enough of it available that it can make a difference for like an average school or a college?
Yeah, I'm hoping there'll be an update by the day's over, but I'm not for sure. I don't have all control over that, but I think very quickly. Look, WashU's been working on this for a long time. We knew it was in the approval status. We was hoping, as a matter of fact, 30 days ago that this would have been approved. There's some other things that go along with having the equipment to be able to utilize that. But look, this is a game changer. When you think of that being done here in Missouri, to be able to have rapid testing, one of the first that's going to go across the United States. This model will, and I'm confident it will. You've also got Pfizer here in the state of Missouri that's working on a vaccine. It says a great deal for our state and the technology, the healthcare system we have, that we're going to be leading the nation in those two things.
Hi, Governor. Protesters have been coming to the Capitol throughout the special legislative session. They've shut down proceedings in both the Senate and the House. You've said in the past that police reform is too contentious of an issue to tackle during the special legislative session. Can they get a commitment that this will be a priority in 2021?
Yeah, I think they're doing reform right now. We got the Post Commission out traveling across the state right now trying to gather information on how that reform might look. I know Kansas City just done some here recently, I think, meeting with their commission. So I think you're seeing that happening all over the state. Look, when special session was designed for violent crime, for homicides, for murders, is what that was told, to try to go after that element of people up there. That's a totally different subject from what we're going. And the reality of it is homicide in our state's driving special session. So, all of that's going to come to be. There'll be a legislative session, and we'll see how we move forward on that. But I think right now, for me as the governor, that's why we sent the Post Commission out to start gathering information. We're not going to wait till the first of the year to start developing this and trying to figure out how we do it better.
Hi, I'm Zilla with ABC 17. So MU students are back now, and they have 168 positive cases for just that first week. Does the state have any plan to help the university kind of catch up with the virus?
No, I think one of the things we've done, we've met with all the university presidents here in Missouri. All of them have. They have very good plans in place how they're going to deal with this. So this was no surprise that students were going to come in here and test positive. About every university I talk to has quarantine areas. They're going to provide the education those students need, or the option that they go back home or they don't come in there. But all of them have a very good plan in place. So I think when you look at the overall picture of the state of Missouri, those things were going to happen, and those administrators and the presidents and chancellors have been doing a really good job of handling this situation.
Thank you. Governor.
All right. Thanks, everyone.